The broadcast is now starting. All attendees are in listen-only mode.
Hello, and welcome to our webinar recording on Are You Prepared for COVID-19 Testing in Your Pharmacy? My name is Jason Ausili. I'm a pharmacist, and I'm also the Chief Clinical Officer at FDS. First off, I want to take a moment to thank you all for serving your community as frontline providers in this time of crisis. Hats off to all the pharmacists who are doing whatever they can to keep everybody safe while ensuring your patients are receiving the medicines they need and the care that they also need. Our hope is that today's webinar allows you to walk away with an idea, additional insight or encouragement to move ahead on something that helps you further transform your business and better take care of your patients. Today, we are going to spend some time focusing on the medical billing opportunity that comes along with the ability to test patients for COVID-19. This opportunity and responsibility doesn't come without barriers and challenges. As you probably all know, on April 8th of 2020, the HHS authorized pharmacists to order and administer COVID-19 tests. Although this is an exciting opportunity, there are some barriers that are in our way. Many of us have limited to no experience performing point-of-care testing in the community pharmacy practice. In my opinion, and the opinion of many experts, educators, and the public, pharmacists are completely qualified to perform these tests. That said, there's likely a gap in knowledge that helps prevent pharmacists from feeling comfortable and confident in performing these tests. A recent poll by the Morning Consult that was done between March 26th and March 28th among a national sample of 1,995 registered voters showed that 86% of people say pharmacists should be allowed to provide tests for COVID-19. Another 86% say pharmacists should be allowed to provide a vaccine or other medication to protect against COVID-19 when developed. So it's clear that the public trusts us and sees us as providers of COVID-19 tests and COVID-19 treatment when it's available. That said, state-based guidance is still lacking. States can be more stringent than the federal government. So even though the HHS has authorized pharmacists to order and administer tests, there's still guidance and clarification that are needed in certain states. Also, the availability of high-quality point-of-care tests, the type of tests that are covered by the CLIA certificate of waiver, haven't gotten an emergency use authorization by the FDA yet, although we may be just a few days away from having these available on the market. Also, pharmacists will require PPE, or personal protective equipment, to some degree in order to test safely. Will it be available? When the ideal PPE is not available, what can you do or what will you do to be safe? Do you have a CLIA certificate of waiver already in place, or do you need to apply for one? Also, do you need to rethink your current workflow to promote safe testing in your pharmacy? For example, if you're performing antibody testing in asymptomatic or healthy people, is that different than performing antigen testing in symptomatic people? I went to my dentist's office recently for an emergency visit, and the process that I experienced when visiting the office I thought was notable. I pulled up to the parking lot, texted the dentist that I was there and ready for the appointment. They gave me instructions on when to enter the dentist's office, took my temperature, and only if my temperature was normal would they allow me back to the exam room. Fortunately, I tested with a normal temperature, and they escorted me back to the exam room, and I was the only person or only patient in the office at that time. So as we think about what our workflow looks like during COVID-19 testing, I think these things are important to take into consideration. Is your pharmacy set up to bill for this as a medical claim? That's a big question. Since this is a medical service, it gets billed to the medical benefit and not the traditional Part-D or pharmacy benefit that gets billed through the claims process, the NCPDP claims process. Now I'm going to pop over and say some of the things that we can do to help. We can help you not only get set up to be a medical biller, get you through, provide assistance in the CLIA waiver process as it relates to your specific state-based needs. But also there's some additional information regarding other enrollments that I'm going to cover in just a bit. But we're also here to help reduce the friction in any way we can for you as a tester and a medical biller. And we want you to thrive as a provider in your community. Because of that, we're developing a COVID-19 testing, training, and education program that's designed to be a crash course in point-of-care testing and highlights the practical things in practice that will make you feel more comfortable and confident in administering these tests. This program will be announced in an upcoming webinar that we'll be holding later this month. Next up, I want to cover at a high level what you need to be prepared for with this potentially unprecedented medical billing opportunity. CMS recently announced guidance that opens up the reimbursement pathway for pharmacists to bill for administering not only COVID-19 tests, but also flu and RSV tests. Due to the similarity in symptoms that flu and RSV present, they've gotten looped in with the COVID-19 testing practice that's involved in the public health emergency. So it's a really exciting opportunity that's opening the door for COVID-19 testing, but also other important testing avenues during this time of crisis. It's important for you to be prepared for this medical billing opportunity that can open, other doors for testing in your practice, not only COVID-19, flu and RSV, but also strep, cholesterol, A1C. There's a lot of other opportunity for pharmacists as testers that are out there. Some of the things you can do to be prepared, I mentioned enrollment and registration. Obviously, the CLIA certificate of waiver is needed in order to get reimbursed. So it's a very important step. If you haven't applied, you should apply. Also, you need to ensure that not just your pharmacy has an MPI number, but each pharmacist of the administering test needs an individual MPI number. And then finally, there's what's called a PTAN, or a Provider Transaction Access Number. It's accessed through the electronic enrollment at provider enrollment, or at the provider enrollment chain and ownership system, or PECOS. And right now, it's easier to get a PTAN number than it's ever been. Because of the public health emergency, they've waived the background checks and the fees that were historically with the PTAN process, and even have a hotline number to assist pharmacists down this pathway. As I mentioned, education and training is important. Having the knowledge and skills, being completely qualified for this as a pharmacist, fine-tuning the knowledge and skills on the practical practice of point-of-care testing is key. We are developing an education program that focuses on not only a brief overview of the COVID-19 disease state, the different types of tests and what do they mean, what are they good for, proper specimen collection that goes along with each type of test, the proper use of PPE and what to do if the ideal PPE isn't available, how to incorporate testing into your workflow, how to report test results to other providers in public health. But finally, you need some tools and resources in order to get paid for the testing or for the testing service that you're providing. And as mentioned, you'll need a medical billing platform, since this falls under the medical benefit and not the pharmacy benefit. We can help you with this. We have FDS MedBill that's set up to fully get you reimbursed for the services that you provide. And also, because we are providing a higher level of care, documentation is more important than ever. Having sound clinical documentation of what you did and details on the patient experience during your clinical interaction is key in this process. And we have FDS Engage has a great documentation process to help you to make sure that you've documented all the things you need to document in order to deliver this care appropriately. Finally, medical billing requires the pharmacist to do certain things that might be outside of what you're used to from a billing perspective. With the HHS authorization that allows pharmacists to order and administer COVID-19 tests, and the CMS guidance that really clears the path from a billing infrastructure for pharmacists as testers, the doors are opening for a really unique and unprecedented medical billing opportunity. I'm not going to get in too far into the weeds with this now, but I want to touch on a couple of areas that are important to understand at a high level. Terms that you should become familiar with are the CMS HCPCS or HCPCS and CPT coding guidelines for COVID-19 testing. Recently, CMS released guidance on not only the COVID-19 codes, but also the codes for influenza and RSV tests that are required for getting reimbursed or for billing and reimbursement on this front. Also, an understanding of the CDC guidance on diagnosis and ICD-10 codes is important. You need to understand what to input based on a positive or negative test, which may be different based on which type of test you use, whether it's antigen to determine the actual presence of the virus, or antibody to understand if the patient has some immunity to the virus. So understanding which codes go along with which tests and understanding more details on this front, we'd be happy to cover in an upcoming webinar and hope you can join us. That said, we're really excited for this opportunity to help you develop a medical billing and testing practice. We believe that there's a learning curve for a pharmacist to get to what we consider the new era pharmacist and the community caregiver that we all know you are, and you can elevate your role as providers of care in your community. And I see this as an ultimate opportunity, not only for us to provide a higher level of care, but also get paid for those services that we're providing. With that said, in closing, I just hope that you found this webinar, this brief webinar, valuable, and that you walk away with a few ideas and motivators. Again, we thank you for your service on the front line as providers who are taking care of your patients day in and day out. Stay safe and healthy. We hope to catch you in the upcoming webinar. Thank you.